All right, welcome back, guys. Episode 3. I'm Kyle Adams with Adams Performance RVA. If you haven't seen the episodes yet, with my guy Chris Fosdick here with Mercenary Physical Therapy back in the house. So we're back in Adams Performance today, and we wanted to talk a little bit more about, I think, what we both do and where we see ourselves within this fitness and physical therapy situation we've gotten ourselves into, and a little bit of the history of it, and kind of how we've gotten to where we're at today and what that means for what we want to do in the future. You want to talk a little bit about, about Gray Cook and the functional movement guys, and where everything came from?
I was actually thinking about going a little bit earlier.
Yeah, sure.
And I was kind of going back even 1960s, 1970s, where really the only people that quote unquote exercised or worked out were bodybuilders and maybe athletes.
Yeah.
So I think a lot of the American tradition comes out of those two groups. So you fast forward 20, 30 years, and there's very little applied sciences or clinical scientific type use in American sports training and athletics, which some people argue is why we got destroyed in the Olympics by the Soviets.
No doubt.
So Gray Cook and Kelly Starrett, who did Mobility WOD, both of them kind of at the same time were talking about how technique and biomechanics matter for athletes. And the famous thing Gray Cook did was he puts up a picture of a female athlete landing from a jump, and it's, complete knees together, valgus collapse. Yeah. And he pointed to it and he was like, their team physician cleared her back to play after ACL rehab.
Right.
Their athletic trainer cleared them to play. Their coach cleared her to play. And he kind of pointed at it and was like, clearly something does not look right with this picture. And they did a great job. I think that got very much embraced. And we were just talking maybe a little over-embraced at times.
Yeah, the whole functional movement screen, which has become so popular, which, I use. I'm TPI.
Great tool.
Yeah.
Great tool.
I'm TPI certified with the golf side of things, which totally comes out of Gray and all that fantastic work. But it's a tool. It's not the end-all, be-all of everything. So I think it taught us a lot. We just have to continue to adapt based on the new research coming out. I mean, I think we all know now that screen itself can't quite predict injury, and hasn't really been shown to do that. But I think those guys have evolved too, and all say look, that's fine, but we think we have a pretty good qualitative screen to get some baseline data, and that kind of tells this whole team situation where athletes or patients need to go and when they need to get there, and who's the boss, I guess. I think that's the idea that both of us want to continue to push on folks is who should be the boss between the fitness coach, strength coach, the physical therapist,
skills coach.
And then the skills coach, so baseball coach, BJJ coach, doesn't matter, but the technical person, and how we all fit in that.
And that's where I think both of our backgrounds come in, is we've been both hats, maybe even 3 hats.
Yeah.
Not all at the same time, but definitely know what the grass is like on the other side.
No doubt.
And I like that there's a lot of collaboration these days, even if there's some contention.
Yeah.
Let's say some contention at times.
Well, so maybe you can fill in your experience a little bit with that, and why that's important in terms of scope of practice is a big deal for us, since we both of us went to school to get doctorates and yada 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 and all these certifications and the initials after our name that hopefully mean something, but we know that that's passing a test. That's not practicing what you preach and getting better every day. And so where do we fit as doctors of PT, physical therapy, versus, let's just use an example, a high school strength coach or a CrossFit coach who's more of a technical coach, or fitness trainer. How do those worlds blend, and who can do what when? I mean, what are your thoughts on that?
There's a lot of overlap on that. The way I try to break it down in my mind, big picture, and for the people I work with, is that when I'm wearing my clinical PT hat, I'm trying to restore what was previous function.
Yeah.
When I'm wearing my personal trainer strength coach hat, I'm trying to improve existing function.
Yeah.
So strength trainer, coach hat is someone says, hey, I'm lifting 250 in X position. I want to be lifting 300. And I'm like, all right, can do. Let's get some programming. Let's get some reps underneath your belt. When someone sits there and says, I was lifting 250 pounds in X move, and then my shoulder started bugging me, then I'm switching hats and putting on my PT hat and being like, all right, well, let's get you back to 250, and then we can get you to 300.
Yeah, that's a good point. I never really kind of thought about it quite like that. I think for me, I always have said that I differentiate between the two when it comes to when pain enters the equation, which is a little bit more straight line off of the FMS guys, I guess. If you're getting screened and you score 0, which is pain, but I guess for me, I've always kept it that way. That's just when when you need to see somebody in the medical world or a PT, or it just depends on what you need, obviously. But I think from a performance versus getting back to where you were, that's another good way of looking at it for sure. So why don't we use a very specific example, maybe in terms of how the whole team? Yeah, that's right. In terms of how the team could actually work. CrossFit's popular nowadays. I think both of us are big fans. It gets people moving, and it's better for sure than what most of us have done forever in the gym. That's for sure. And there's you get the team environment and a ton of great things that happen out of that. And that's for somebody that hasn't CrossFitted specifically a whole lot. But I think there was a bad rap maybe for injuries and stuff there for a while.
Another industry that adapted very well
definitely
to its criticisms.
Definitely.
I think there is a far cry between CrossFit HQ circa 2006, 2007 and what most affiliates are putting out these days.
And if I could be incorrect, but some of the literature came out that very clearly, I think, indicates that most high school athletes playing sports have a significantly higher risk of getting injured than anybody who's a CrossFit member or who is CrossFitting. So I got a little blown out of proportion once we actually looked at statistics.
If we substituted CrossFit for high-intensity interval training
absolutely
with heavy loads under high fatigue, I think most people would sit there and say, yeah, it's not a great idea.
Right.
But I think there was some... I agree with your point. That's what I'm trying to
say. Yeah. I mean,
I agree with your point.
Yeah. I mean, what it's evolved into now is very, very different too. But let's just take that as an example, because that is a sport or a level of fitness that I think we all can identify for and now see on TV, where we have this perception of what may or may not happen from an injury risk standpoint, but where we have a bunch of people who are training hard and getting after it on a regular basis, which is no different than what I do as a strength coach basically every day. The programming is just different. Mm-hmm. So, all right, let's say, Billy that was trying to, squat 450 because he's competing next weekend in a, little competition, hurts his back squatting. So the technical coach, the CrossFit coach in this case, is managing that, saw it happen live. In your mind, what happens in the team, and what's the best way to go about taking care of that guy?
Oh gosh. Okay, so let me break this up into the two sides. We have the strength coach side and we have the PT side. Yep. Part of the clinical training is, for anybody who's pretty specialized in sports medicine, orthopedics, back pain isn't just back pain. Back pain can be a whole lot of different things, ranging from benign to somewhat scary. So part of the training you get is how to appropriately say, yes, go ahead, keep training, lighten the load, and put that onto the skill coach and be like, just don't do X, Y, and Z.
Yeah.
Stick under these numbers until he can do X, and give very specific advancement criteria for progression.
Yeah.
If it's something that you deem is a little bit, it won't respond well towards gradual progressive loading.
Sure.
Then you have to kind of take them out of the lane they're in, put them into a slightly different lane until you can slot them back to where they were.
Yeah.
So the way I'd manage that is, do a quick 15, 20-minute movement screen, see what bugs him, if it correlates to certain factors that I'm afraid of, or if it's a relatively vanilla low back sprain, strain.
Sure.
If it is fairly benign, give them back to the coach, give the athlete some instructions, do the rice, do some stretching, do some light exercise as long as it doesn't make things worse.
Sure.
And then keep an eye on them. Check in after 3 or 4 exercise sessions, maybe a week, and say, are things getting better, things getting worse, staying the same. If they're getting better, rock on, keep riding that train. If things are getting worse
Yeah.
with a thing that you would expect to make it better,
Yeah.
then you have to revisit and look at a couple more things.
Sure.
If it's staying about the same, then I would change some things up, either lighten the relative load and try and get them into that top category of things getting better. But if things were kind of weird from the get-go, like it was a young athlete,
Yeah.
and they maybe had a little hyperextension, so there's some bony congruency issues like a spondy,
Yeah.
then obviously you have to get the appropriate
Right.
medical intervention, get x-rays, make sure you know what you're dealing with, and then rehab appropriately.
Yeah, so maybe if maybe if when he's squatting, he's got some issues. It's a little bit of irritation. It's going to calm down in a few days anyways, and we know that if you come in and spend $100-200 with us, acutely, it can probably take care of some of the pain, but it's probably going to get better anyways. So maybe you manage that up front. Tell them to stay away from some bad stuff. In terms of aggravating things for them, probably another run of squat 450 in that case, and let it calm down a little bit, and then see where they're at after a few days, and then they don't have this added cost and worry and all this stuff of a more formal, medical situation. And a lot of times that works, and that's best. Versus, hey, it's not getting any better, and maybe I have competition in 2 weeks. Can I come and see you? And I think that's when guys like us realize that maybe they had a little bit of a technical issue, or maybe it was just, maybe 450 was too much.
Too soon?
Yeah, tissue overload, and now you have a tissue situation. And then I think for us, that's when patients can come in, or at least you right now, not me, but hopefully in the future. And hey, we can do some manual therapy and some different things that we know change pain, or seem to change pain for a wide variety of reasons that are hotly contested. But who cares? I don't care. As long as it's quality and it gets them feeling better and moving better. So, all right. So let's say didn't get better, patient comes to see you. You see him in the gym for a couple of visits. Whatever. Cracking backs, dry needling, soft tissue work, exercises afterwards to take advantage of that, or get them moving more. Whatever. They feel better after. Let's say 2 weeks.
That's the dream.
And
That's the dream.
And competition's in 2 weeks. What happens next between you and skill coach, and who's the boss?
Well, if I was being a good clinician, I would have kept the skill coach in the loop.
Yep.
Because obviously any good skill coach, which I've been learning more and more, especially with competitive weightlifters, they stay on top of their athlete's training schedule.
Yep.
And they do, I think, a much better job of prescribing and dictating reps, sets, exercises than almost anybody else.
Sure.
So I'd be keeping them in the loop. Here's what I think they can tolerate. Here's where I would like them to be in X number of time. See how that fits in with their goals.
Sure.
And then anything we disagree on, we have a little powwow and say why. Well, it's like, I don't think this is going to get better for him to do an 80% for 3, so he can get an appropriate peak before his deload into competition. So if he's 2 weeks out from competition, he's feeling better, then we're going to have to modify that plan that the skill coach had, because obviously he's expecting improvements from the time of injury. So we might have to average it in the middle, because any headstrong young athlete is going to be like, put me in, coach. I'm going to go and I'm going to do 110% the week before the competition, and I'll be fine by the competition.
Sure.
So you've got to get all 3 people, the athlete, the skill coach, and maybe someone on the clinical side, trying to adjust fire.
And it seems like, that I think is what's most important to me too, is I think hopefully the way that we practice is we're trying to get rid of some of the ego in situations where you've got, let's say a skill coach who's been coaching lifts forever, and it's like, well, PT's stupid, like this is what you need to do, I know this is what you need to do, which I respect, highly, but that's not necessarily ideal. What's ideal is that they still know that in the back of the head, but come to you because they know that you're good at handling pain, and also have that, maybe that's you in this case, maybe not. In this case, let's say no, and they do have a technical coach, and you guys will sit down, like you said, and get on the same page, and that's where all the magic happens. I mean, and clients, patients, call them what you will in this situation, are paying all of you typically good money because they have a goal of squatting 450 in competition, and that's what makes them happy in life, or fitness makes them happy in life. So everybody being on the same page is super important, and that's what I run into with baseball. One of my kids had some elbow issues, felt to pop this kind of situation in a game, college commit, he's afraid he's going to lose a scholarship potentially, comes in, ended up just being what looked like a little nerve issue, told him to keep an eye on it, had him change his throwing schedule, do some different things from an arm care perspective, and we managed it in 2 weeks, and he goes out and throws gas for the rest of fall ball, shuts it down for the off season, and everything's golden.
Awesome.
Versus, could have been an MRI situation, this and that, and we just didn't quite need that. If I felt like it was something more serious, and obviously I'm sending him out to get taken care of right away. But instead of a $7,000 situation, because coaches all talk to each other, and I talked to his high school coach, we all got on the same page in 10 minutes, and we're all good. And and here we are. That I would say is a heck of a lot more optimal than two coaches not communicating, that person just bouncing all around an uneducated medical system, versus finding specialists that all talk and know what they're doing in relation to them specifically in this case.
Also super confusing for the patient/client, because they have all these people that they trust, and I'm sure you run into this all the time. This person said this person says this, that directly contradicts this, and then this third person says this.
Right.
So they end up kind of believing whatever they want,
right,
for good or for ill. I'm not saying that they shouldn't, but having one message for someone who's relying on you to take away that guesswork is, I find, very comforting for those patients and clients.
Yeah, absolutely. Like, I like to play golf. Golf is one of my niche markets. It's that in baseball. I'm great at screening for golf. I'm great at making people better at golf from a fitness standpoint, but you can bet I'm going to, my guy that takes care of all my swing stuff to take care of me technically, right? Because I pay him for that, and that's what he's good at. I'm not good at that. I don't know anything about that, and I don't want to be involved in that because I'm not the best. If I'm better than him, then maybe that's fine. But I'm definitely not. He's the man, so that's why I go and shut up and take lessons from him. And
everybody needs a coach.
Everybody needs a coach.
Everybody needs a coach.
Yeah, we need strength coaches, and we're strength coaches. That's the way things work. But you got to take the ego out of realizing that you're not the smartest person in the room all the time at everything.
I hear there's a saying about that.
Yeah, that's what they say. Yeah, and it doesn't work out well.
Yeah.
When you don't listen.
Need a different room.
Yeah, need a different room. So I think that's just a good illustration of a team system and team respect, and why in this case you're finding people that are all respectably good at what they do but know how to communicate to your situation specifically, and if you don't have one, then find one. And that's probably what's most important, is as a fitness person or a patient or whatever, you always have to be your best advocate, I think. And hopefully once you find that group of professionals and put them together, beautiful thing.
I also think it's important that we start developing that mentality, and I want to say franchising, but that's not quite correct.
Yeah.
But getting that kind of professional standard down, because, like we were talking about history, to try and tie this back in, is we have so many more people exercising and training, and it becoming the medical recommendation, like, you should exercise, you should do these things.
Yeah.
So we're going to have a boom of Americans, I think, over the next 10 to 20 years that are accumulating these reps, these miles, that are going to need some of that, rather than maybe 10, 15 years ago where the majority of people didn't exercise, and they didn't understand why they should.
And I think now we're shifting to a model where, we love physicians and docs just as much as anybody, but they also fit within this model. And look, any good surgeon will tell you the same thing. Everybody's on the team, like, hey, I do my surgery and then I send them to my rehab guy. That's what James Andrews says, and he's probably the best in the world. So, I think the more that all of us get on the same page and then can communicate that to, our clients and our patients and the general public, I think the more that seems to be the normal thing in people's minds versus 10, 20 years ago, and that wasn't. Silent. Nobody communicates, and you go see your doctor that typically takes care of people with the flu and colds, and when you have a sports medicine injury, gives you advice, which is typically just absurd. And
it's not absurd. It's low risk.
Or low risk.
It's low risk. It's low reward.
Sure.
Because for a physician who's used to dealing with congenital defects that have a high mortality rate, or trying to screen out people with cancer, someone coming in with a shoulder injury being like, hey, I can do everything I want, but I can't bicep curl 200 pounds. I'm at 180.
Right. Well, don't do that.
That physician is going to sit there and go, so?
Right.
You're breathing your heart's beating, you don't have any trouble, go talk to someone else.
Yeah, right.
Like,
right.
I have a kid next door
Right.
that is going to suffocate if I don't do something.
Right.
So I completely understand where they're coming from. That's not their specialty.
And then they're like, well, so do I have to pay you for that advice? I guess, since I'm here, and that's where it's wasted time. And, and that's fine. But I think as long as we get it on the same page and it's normal, then it's good.
Yeah.
Cool.
So, if you have any questions, if this sparked any thoughts, take this time right now. Text us. Twitter, Instagram, Facebook, YouTube.
Wow. That's legit.
All of it. Adams Performance.
Adams Performance, RVA.com. It's got all my stuff there.
Mercenary, physicaltherapy.com. Pretty sure if you just search Mercenary Physical Therapy, I got on the ground floor on that name, so it should take you to me.
Nice.
Hit that like button. I hear a lot of people say that on YouTube. I don't know.
Yeah, I don't know what that means, but it probably doesn't matter for us. Maybe one day.
Next time.
All right, next time.